afternoon.
Hi, good afternoon. My name is Carrie Peterson. I am your occupational therapist today. So thank you so much for coming in, Nicole. I am taking a look here at the order that we received from your physician, and I understand that you've been experiencing some issues with your wrist related to volleyball. Now, can you tell me a little bit more about what's been going on?
Yeah, so my wrist has been hurting for quite a few months now. I do play volleyball, like you mentioned, and I think all of the serving and spiking has started to take a toll on me. The pain has gotten worse lately, and it's genuinely been making it hard for me to play.
I see. I'm sorry to hear that. I definitely do understand how volleyball can take a toll on your body. I used to play as well, so I definitely understand. Now, how would you describe your pain? Is it sharp, dull, or more of an ache? And does it worsen with certain movements or times of the day?
It's usually like a dull ache, I would say, but sometimes it does become a sharp pain when I'm serving or just playing volleyball in general. It definitely gets worse when I am playing, especially after very long practices, which can happen. And on days when I don't play, it does feel better, but it doesn't completely go away either.
That makes sense, especially since volleyball does involve a lot of repetitive wrist motions. Now, has this injury affected any other aspects of your daily life, like work or personal care or hobbies outside of volleyball?
It definitely has. Typing on my computer for work-related assignments starts to hurt after a while, and even things like just brushing my teeth or holding my phone causes it to be sore. I've had to cut back on making pottery, which is something I love doing, because my wrist starts to hurt just after a few minutes.
Oh, okay. It sounds like this is really impacting your life beyond just volleyball. Can you tell me what your values and interests are? Are there any people in your life that are important to you?
So a lot of my values and interests genuinely involve just being active in general. So I like to travel a lot. I'm usually traveling very often.
Okay.
I also go to the gym, so I'm active in that space outside of volleyball myself. I also go to concerts very often. I'm a K-pop girly, so I'm always at a K-pop event. I collect photo cards, and I attend K-pop events and concerts as a whole. I also practice a lot of self-care, so like skincare, journaling, going to the beach, just to swim or to have a moment of meditation in the morning.
Yes.
I'm a video gamer, so I like to play video games as well. And I tend to drive very often because I do have anxiety. It helps calm me down. Like I mentioned earlier, I make pottery, so that's a big hobby for me. And I also, of course, play volleyball. I think important people in my life would be probably my mom. My mom tends to coach me and give me a lot of guidance, and she always supports me in everything. So I think her being in my life is probably the one person that I can say I can count on.
Perfect. Thank you so much for sharing that. In terms of your typical day, can you walk me through what a regular schedule looks like from the moment that you wake up to the time that you go to bed? I'd just like to get a better understanding of where this strain might be coming from.
Yeah, sure. So on weekdays, I typically wake up around 5 in the morning so I can get
early bird.
Going to the gym. And then I come back, I take a shower, and I start getting ready, preparing myself for work. I work from home, so I usually will take meetings, reply to emails. I'm a social media organizer, so I create content, whether that's scripts, captions, just content related. So I'm always online. And then after I finish my work day, I usually go to volleyball practice, and then I come back and I start to work on anything that I might have missed during my work day. On weekends, I do try to hang out with my friends, but I try to get in extra practice when I can. I just haven't been able to lately because of the pain.
Yeah. It sounds like you live a busy, productive life, which is good. I'd also like to ask about your environment. So are there any specific factors in your home, work, or volleyball setting that you think could be contributing to the strain in your wrist? So like, for example, how is your desk set up at work, and what are the type of equipment that you use while you're playing volleyball?
So like I mentioned, I do work from home, so I just use like a desk and a chair, or like my vanity is my desk. But I guess my posture could be better. I sometimes will take, if I'm having a very lazy work day, then I'll just work in my bed. So it's just me, my bed, and my laptop. So there's nothing special there. And then same thing for volleyball. It's nothing special. It's usually just, you know, the whatever volleyball equipment, like the net, ball, like just regular stuff like that. Lately though, I have been noticing a bit more pain in my wrist when I have to pick up my dog because she is very needy and she also has back problems herself right now. So whenever she asks me to pick her up and put her places, I notice the pain in my wrist kind of strains more, especially in those moments and when I'm typing things on my computer.
Yeah, that makes total sense, definitely. Especially as a pet lover, a dog lover, you can never say no to them. So I definitely can relate. Okay, so now, let me just see. Okay, so those are great details, and we'll definitely look into some adjustments to your work setup that might relieve the strain on your wrist. Now, moving on to personal factors, are there any beliefs that influence your approach to health and recovery? So again, for instance, like a specific approach towards managing your pain or maintaining balance between sports and other life priorities.
So I really do believe in pushing myself and just trying to be the best, especially when it comes to volleyball. But I also don't want to continue to injure myself to the point where I can't play anymore. It is tough because I always want to improve, but I also know that my body needs time to heal.
Yeah. That is a great mindset either way. And a great outlook on it. Now, wanting to push yourself while being mindful of your limits is crucial in recovery. Is there any role that spirituality or mindfulness plays in how you cope with challenges, whether physical or mental, when it comes to volleyball or your injury?
I wouldn't say that I'm super spiritual. I try to, stay positive and calm when things get tough. I also practice tarot cards, which has been really hard for me too because of my wrist, because shuffling cards is not fun with an injured wrist. But that's kind of what I like to do to keep me kind of just mindful. And then I do like to focus on what I can control. So things like my attitude, effort, instead of trying to stress over things that are out of my control.
Yeah, that's a wonderful mindset, actually. Very, very positive. And that can really help towards recovery. Now, let's talk about priorities and goals moving forward, right? That is the goal. So what's important to you in terms of getting back to your regular activities? Is it more about pain relief, or do you have any specific performance goals in volleyball that you'd like to maintain or achieve?
I would say both, in genuine honesty. Pain relief is, of course, really important because it's hard to play when, something is causing you pain.
Yeah.
But I also don't want to lose my edge in volleyball either. I want to keep improving my skills, especially with my serving and setting. I do have some upcoming matches that I definitely don't want to miss. So,
yeah, I can definitely see how important volleyball is to you, and we'll definitely work on a plan that balances pain relief while also maintaining your performance. Now, in short term, what do you see as your top goal? And then for long term, how do you envision your progress?
So short term, I definitely want to get back to playing without pain, or at least less pain. And then for long term, I would say that I want to keep getting better at volleyball and continue to remain injury free.
Yes. Those are excellent goals, and I am confident that we can create a treatment plan that aligns with them. So we'll explore ways to modify your volleyball techniques to prevent further strain, and I'll show you some exercises to strengthen your wrist. Let's see. We can also look at adjustments for your work setup to make it more wrist friendly. Now, how do you feel about incorporating these things into your daily routine? Are there any barriers or challenges that you think might get in the way of sticking to a new routine?
I think I can do it. It's just challenging, of course, because I work, from 9 to 5, obviously, and then I have all of the other activities that I try to participate in. So time management is a little tough there, but I think I can make it work.
Yes. It's great to hear that you are motivated, and we can definitely work on making a plan that is manageable with your schedule. I do understand life gets in the way, but it is important to remember to prioritize your health. and to manage the pain in the best way that you can. So I'll introduce some strategies for time management, and so that you can fit in the exercises and modifications without feeling overwhelmed. So we will get started with some wrist movements to assess your current range of motion and your pain levels. And then from there, we'll build on a personalized plan for you, okay? Now, how does that sound?
That sounds good.
Yeah.
I'm ready to get started.
Okay, awesome.